Our first guest today is Heather Reardon of Novant Health. Welcome to the show today, Heather. It's such a pleasure to have you.
Thank you for having me.
You're welcome. Now, how long have you been with Brunswick Novant Medical Center, and what exactly is your role there?
I've been here about 4.5 years, and I am the Director of Professional and Support Services. And so I oversee the radiology department, the laboratory, and then I also have oversight for all of the outpatient physician clinics in the area.
Wow, that sounds like a big job.
It is at times.
Well, I'm curious, what brought you to Brunswick County?
My husband and I were looking for a change in lifestyle and, more importantly, warm weather.
Wow, and you found it here.
I sure did.
Well, let's begin today by talking a little bit about your education and then your background.
Great. Yeah, I have a Bachelor's of Science in Healthcare Management, and I have a pretty diverse background. I have been employed at both large facilities in the Boston area, as well as outpatient imaging centers and physician clinics.
Wow. And you mentioned you work with the Novant Medical Group practices in the area. Who are those practices?
We have several. We have Calabash Internal Medicine, which is in Calabash. We have Oceanside Family Medicine and Convenient Care, which is in Charlotte. In addition to those, we have several specialty clinics. We have Brunswick Pulmonary and Internal Medicine in Charlotte, Brunswick Urology Partners, which is also in Charlotte, and then we also have Brunswick Surgical Associates and Brunswick Women's Center, which recently moved into the new medical office building on the hospital campus.
Yes, I heard that, and I think they had recently had an open house.
They did. It was a great turnout. Well,
today we wanted to focus on a new service that Novant Medical Group is offering called MyChart. And can you tell me a little bit about that? Just give me an overview of what that looks like.
Sure, I'd be happy to. When we began utilizing our electronic health record, which is Epic, our Dimensions project also has the ability to allow patients access to their electronic records, and that application is called MyChart.
Well, I'm curious, what can patients do in MyChart?
There's a whole host of things that patients can do, some of which are they can communicate directly with their care team via email. They are able to...
Including the physician?
That is correct, yes. Wow. Access to the nurses as well as the providers. And they can also view lab results and test results that have been ordered by their physician. And in some functionalities, they can do online scheduling.
So they can go in and schedule their own appointment for some practices?
They can, yes.
And so if they had some outpatient testing done, whether it be labs or imaging studies, once those results are available, they would be able to visualize those in their MyChart?
That is correct, yes.
That would be a huge bonus to me, I would think, you know, waiting on that phone call. And
yeah, I'm a patient and I have access to the application, and it has been a huge benefit. So I can do it on my scheduling, whether it's, you know, in the evening or on weekends. And it also provides you with all of the reference ranges for any lab results that you have done, so you're able to cross-check versus previous testing in other facilities.
So Heather, can you give me an example of how a patient might utilize MyChart to make their life a little easier?
Absolutely. A great example would be if your child became sick in the middle of the night, had a fever, you had some questions, you were a little concerned. You could go online to your physician's, to your portal for MyChart and look at availability, and you might be able to schedule that 8 a.m. appointment to which you could go in and see your provider. They'll be able to see your child and then send a prescription to the pharmacy, all online through an e-prescribe. And you could then leave your physician's office, go to the pharmacy to have that prescription ready, which all changes the way that you treat your child. Whereas before electronic records, you know, if your child was sick in the middle of the night, you would have to wait until first thing in the morning. You'd have to try to call the office and hope that someone could answer and expedite the appointment for you. And this way, if you just have a simple question, you can email that provider as well. So maybe you don't feel as if it's that critical that you be seen. You can ask the question and then wait for a response. And Or if you feel like it's urgent that you be seen, or a child or a loved one, then you can just go ahead and schedule that appointment online.
Well, in that scenario with the prescription, that would cut down on the wait time. I assume that when the patient arrives at the pharmacy, it's likely that the prescription would already be ready, and so your child is on its way to recovery much quicker.
That is correct.
Yeah,
yes.
That does make life easier for a mom or a father who's dealing with a sick child. So let me ask you this. If you had a rash or something like that, would you be able to communicate with the physician about that rash or that wart or whatever you're visualizing on your face?
You sure can. There's a function in my chart to where you can take a picture and upload that picture through the portal to the physician and send the question whether or not you think it's something urgent, and the provider can then review that picture and determine what your next steps are.
That's really techy.
Very cool. Very cool function.
And you said that labs and other tests results are also available in my chart.
Yep, the history of lab results that were done at that practice are loaded into my chart, and so you're able to have a comparison, month over month, if that's how frequent you have your labs, or to be able to go back and see if you're making progress, or perhaps you have areas that you need to work on, but that all remains within your My Chart portal.
So you can see your cholesterol results from several months back if they're provided you've had those tests done, and see how you're doing, whether you're going up or down, right?
And another great feature to that is it's available on your mobile devices.
It is?
It sure is, yep. And so if you have an appointment with a specialist, perhaps that is not on the Epic system or part of the Novant Medical Group, you could have access to your record in the office to share lab results if there is ever any questions.
Wow, that's a real plus. Currently, I know physicians typically call your home and leave messages on your voicemail, and you're asked questions like, is it okay to leave the message or give it to your spouse or significant other? How about in My Chart? Can you do something like that?
You sure can, yep. You just need to work with the provider in the office and make sure that you have the proper authorizations in place and proxies in order to be able to view spouses or children, other health information.
And you can have access to your child's records also, but I assume that after a certain age, it's probably
that is correct.
Changes.
Yeah. And even with it being the child, you still have to fill out, the proper authorizations for the, the minor proxy.
Now, My Charts is web-based, is that correct?
That is correct.
So you access it through the internet. And I'm curious about safety and confidentiality of that. Can we talk about that a little bit?
Sure. We use industry standards in terms of all of our security measures, and so the application itself is secure. However, you always want to be careful to make sure you don't leave yourself logged in somewhere, or you have multiple browsers open at the same time to make sure caches aren't floating between the programs. So as long as you properly use it, then the application is secure.
How many of the Novant Medical Group practices are utilizing My Chart?
Currently, we have 3, and they are all part of one larger medical building, and that is Oceanside Family Medicine and Convenient Care, Brunswick Urology Partners, and Brunswick Pulmonary and Internal Medicine.
Will other practices be joining soon or in the near future?
They sure will. We're in a system-wide rollout phase, and we hope to have all the remaining clinics here in this market up by end of year 2013.
Wow, great. Well, before we close, is there anything else you would like to add about My Chart or about Brunswick Novant Medical Group?
Sure. I just want to say that Brunswick Medical Group, as well as all of the systems, are all patient-focused and quality-driven. We aim to provide the safest care possible, and My Chart is just one application to help patients have convenient access to their health information.
Good information, Heather. Thank you so much for coming today. It's been a pleasure having you, and hope to see you soon.
Thank you so much.